Welcome. The people you are about to meet through this film come from many walks of life. They all have established careers in academia and/or the healing arts. Each of them has developed an interest and passion for Rosen Method movement and bodywork because they have experienced, through Rosen work, the heart and presence of embodied self-awareness. It is our hope that you will hear, see, and feel something in this film that will inspire your curiosity and wonder at how the tools of Rosen Method movement and bodywork can change the world, one movement, one touch, one person at a time. In the next segment of this video, Alan Fogel, a research psychologist, will discuss his scientific research on how Rosen Method works in the context of neuroscience. Embodied self-awareness is our feeling state. Rosen facilitates our access to this state of embodied self-awareness. It is about getting in touch with ourselves as feeling beings rather than as thinking beings. Alan discusses how our neurobiology is affected by trauma and how to work with people who have come from a traumatic background. We hope these interviews will help us find new ways to talk about what is actually happening in our bodies from a neuroscience point of view during Rosen sessions or movement classes.
I've worked with so many different people as a practitioner, and Rosen seems to reach many of them in very different ways for the things they need. I had this amazing experience last weekend working with a friend of mine who had a stroke. I never imagined that Rosen could do anything for a stroke victim who supposedly has lost some kind of neurological function, was paralyzed on most of one side of the body, and yet there was feeling there. I had the sense that there was this person there, totally present, who connected with me through that touch. So, could Rosen be used for stroke victims? Maybe. Could Rosen be used for somebody in a coma? Maybe. We're doing a research study on Rosen and back pain, and a big part of back pain is psychological, that is emotional. People get stressed out, and then they get worried about being stressed out, and so it causes pain in different parts of their bodies. And it seemed to help all of the people in our study. So yeah, I would have to say that I don't have a good answer to that question, in the sense that I don't know specifically what the benefits might be, because we haven't tried and we haven't studied it enough to know the scope and the reach of the work.
So tell me your 30-second elevator speech if you were talking to another psychologist, a fellow psychologist.
So what is Rosen Method is really the question. And it's a question I've been thinking about for a long time. And again, just like Rosen itself, it's open-ended. But for me, the core of it is bringing our awareness into ourselves so that we can feel the movements of our body, we can feel the emotions in our body, we can feel all the sensations in our body. And it turns out that when we do that, no matter what it is, no matter what way we do that, it somehow brightens us up. It makes us feel better. And there are good neurological reasons for that, because the neurological circuits that allow us to feel from our brains into our bodies are also connected to the parts of our bodies that repair themselves and regulate themselves. So it's almost like self-awareness in an embodied present moment sense shines a light on the parts of ourselves that need help. And our brain can then kind of marshal whatever internal resources it has to address those problems without much else needing to be done.
Being, not doing.
My first experience of Rosen Method was in 1983. I had been a physical therapist for several years, and I was working at Highland Hospital in Alameda County. And I was somewhat frustrated with the work. I didn't feel like I was able to address who the person was. And a good friend of mine, Don Flory, was a psychologist and was in training in Rosen Method at the time. And he suggested that I meet Marion Rosen. And so I went to an introductory workshop with Marion and Louise Barry. And in that workshop, you know, during the process of the weekend, I experienced my first Rosen sessions. And I just loved it. It really just met something in me that touched me deeply. So what drew me in was the holistic approach, that I could actually address the whole person. In physical therapy, at least at that time in my practice, there was an emphasis in Western medicine on sort of the parts of people. They had a shoulder problem, they had a hip problem, but you couldn't really, I didn't have the skills to really address what was going on with the whole person. And so the holistic approach of Rosen really drew me in. The spiritual connection, I felt like when I received Rosen and when I learned how to give Rosen, that I could connect with that place in myself, a more spiritual, where there was more meaning to what I was doing. And also then the non-judgmental part of it. That meant a lot to me, because in a lot of my physical therapy practice or in the Western medicine, it's like patients were supposed to get better, and oftentimes they didn't. And there would be this judgment about they weren't doing it right, or I wasn't doing it right, or something. And in the Rosen, there just wasn't that judgment. So that was very appealing to me. I decided to train in Rosen Method because I thought it would be a good way for me to work with other people. I thought it would be a good clinical tools for me. So I went into Rosen thinking that I was going to be getting skills in order to take care of others. And it wasn't until I got into the training that I realized I had to work on myself, and that really this work was about me, as well as my learning something that I could use with others. The benefits of Rosen Method are increased self-awareness, increased ease in the body, the ability to be more present in one's life, just a lot more self-knowledge. The benefit also, I think, in the relationship between the client and the practitioner, there's a safety and an ability to feel that there's trust there, that you can openly express yourself in oftentimes about very deep personal things. And that the Rosen practitioner is there to listen to that. And so people feel seen and heard in ways that they often don't otherwise. So Rosen Method Bodywork is a hands-on bodywork that takes place on a bodywork table. And it's a very gentle bodywork process that invites the person into the present, into what's going on in the moment. As a practitioner, I'm tracking the person's breath, I'm tracking their muscle tension, and then there's also a verbal dialogue between us, which allows me to know what's going on with them. They can express what they're noticing. I can share with them what I'm noticing about them. And so in this dialogue process, they may become more tolerant of their feeling states. They may become more aware of emotions. It's very, very helpful for instance, for people who have some sort of pre-verbal experiences. They may get a felt sense of things that they aren't able to articulate in a psychotherapy process. It's a very wonderful work.
Loving who you really are.
What drew me in about Rosen Method was the depth of intentionality in the touch. I could feel the difference between a Rosen session and a massage. I was a masseuse, and I was working as a masseuse in the AIDS epidemic in the gay community in San Francisco. I was a Shanti volunteer, and at that time, people with AIDS were not being touched at all. And so I was very lucky. There was a massage school in Berkeley that was doing if you work with people with AIDS, you get this really cheap. And I became a masseuse and started working with people with life-threatening illness and saw that so much emotion could come up as a result of being touched. And I sought out a modality that addressed the emotional component to touch, and that was Rosen. So I decided to train in Rosen because I went to a hypnotherapist, a very trusted hypnotherapist who I'd been seeing, and I had started exploring all different kinds of bodywork modalities, and she put me into hypnosis and did a very classic hypnotherapeutic technique, which is for you to see a blackboard in front of you, and then with your non-dominant hand, you write on the blackboard the answer to your question. My question was, what should I study? And I wrote R-O-S-E-N. So I followed my subconscious into Rosen Method bodywork and have not regretted it. Well, I think what would be interesting to many hypnotherapists is that you actually can touch the subconscious by touching the body. And it is endlessly fascinating. And the feedback is so immediate from the body. It's quite extraordinary to have access to someone's subconscious through touch. And then to be open to whatever material is being evoked through the touch, and then appreciating it as a hypnotherapist is a very different access to people than if they're just sitting in a chair opposite you. The touch is the induction. And it's a powerful, powerful thing, and so amazing as a practitioner. As a Rosen practitioner, I feel more engaged in my own subconscious mind when I'm touching someone, and have learned over the years to unhook from my conscious thinking mind and let my subconscious mind roam around the room while I'm inviting the subconscious to come forward from the client. And then it's through that synthesis that knowing evolves. Knowing and curiosity and direction and guidance, and it's just the most fascinating thing. Also, I think it offers a kind of attunement that nothing else that I have encountered offers. An attuned touch that is reparative for all the crappy touch that we've gotten in our lives. You know, inappropriate, unwanted. This touch is invited, and it's collaborative, and it's reparative. So, my 30-second elevator speech to another hypnotherapist. Well, what I would do is I would put my hands on them. Because there's nothing that I have found that communicates Rosen Method better than touching somebody. So I'd ask them permission, put my hands on their shoulders, and feel in. So my 30-second elevator speech for movement would probably also be to move a little, like hum a tune and just move my shoulders and get them invited in the play. Because I think that's one of the greatest things about Rosen movement, is that it's an invitation to play.
Allowing.
Some of the possible benefits that I can see as an occupational therapist is one of the things that I do, and I've been doing I've been working as an occupational therapist for 30 years now, is that, well, first let me just explain a little bit about what OT is, because many people don't know what occupational therapy is, and then it's hard to let you know what I would say to them or how I would frame it. But occupational therapy helps people we help people be able to do the things that they want to do that are in their daily lives. And we help them be able to do it at the highest level that they can. And you say, well, what does that mean? So in my daily life as an occupational therapist, I specialize in working with people with strokes and neurological injuries. So I literally help people figure out how they're going to brush their teeth, how they're going to wash, how they're going to cook a meal, how they're going to use their hands to do these things. And it's very intimate work. So occupational therapy and Rosen are very similar in that there's this sense of looking at the possibilities, looking at the potential, looking to see what people can do, and really supporting someone in that process of recovery. So I would say that it's different, OT is different, in that occupational therapists tend to be very goal-directed. They see what's going on and they develop a treatment plan to get to a goal for the patient. So what I would say for me as an occupational therapist, first of all, I would not really be able to work as an occupational therapist now unless I had gone through the Rosen Method training. Because when I came to actually train, I was suffering from severe tendinitis of both my arms, and I was in danger of not being able to work anymore. And I do attribute my process of learning Rosen Method bodywork to now being able to continue work as an occupational therapist. Learning different ways of being and learning how to really be with myself and connect with myself in a different way. If I was talking to another OT about Rosen Method bodywork, what I would say is, as occupational therapists, we have been trained with, and as over the 30 years that I've been working as an occupational therapist, know that patients' lifestyles, in my case, type A behavior, can contribute to why someone actually becomes injured or develops a disease. And it certainly affects how someone responds to treatment and how they heal in their process of recovery. So Rosen Method bodywork uses touch and a non-directive, open-ended quality of attention that can allow someone to relax. And in that relaxation, what I find most interesting is that people also can, as I was able to, start to become aware of the unconscious patterns of behavior that can either prevent someone from healing, if you were looking at it from an occupational therapy point of view in terms of specific issue, but also can just change or how it influences how you live your life. Well, I do recommend Rosen movement to an occupational therapist. The way I would frame this is, as an occupational therapist who does a lot of hands-on work and works with patients in a variety of ways, I use Rosen Method Bodywork every time I touch someone, and how I listen to them, and how I hold their process of healing. And I use Rosen movement in my movement retraining. And when appropriate, I refer patients to Rosen Method movement classes, and I talk to them about getting sessions if that seems appropriate also. As an occupational therapist, Rosen Method is fabulous for stressed out healthcare workers. So I recommend I recommend Rosen Method Bodywork for self-care as well as professional development.
The body doesn't lie.
My first experience of Rosen Method occurred, I think it was in 1982, and my Jungian analyst told me that I needed to see Marion Rosen. She never told me to do anything, ever. So when she said that, I paid attention. And I did get to see, well, actually I saw Sandra Wooten in Marion's office on Grand Avenue in the basement. And my first session was with Sandra, and I remember being really scared. I'd done a lot of therapy, but I hadn't ever done much body work. And I got on the table and I could feel myself pull inside, and my mind was just going a mile a minute. And at one point, Sandra said, what just happened? Or what was that? And I freaked out. I could not believe she could, it felt like she could see into my thoughts. So I left that appointment and I had to go home. I remember I went home and smoked cigarettes. Because I was shocked. And I was shocked because, oh my God, she saw me. And then I made another appointment because, oh my, she really saw me. And I went through a series of bodywork sessions with Sandra, Rosen sessions, and I had never been through anything like it in my life, and I was really curious, really curious. So what drew me in to Rosen really was the quality of the touch. It was present but gentle. There was a total sense of non-judgment, which I think was the first time I'd ever experienced that in my life. And also that just this being seen. And mainly I was really curious, what is this? And the other part of it was I was on a journey. I was really doing self-exploration, especially through the Jungian work. So I was very curious about what my body had to say about me, or the connection between my awareness and my body. It was a whole new territory. So Sandra, about 2 or 3 months after I started seeing her, she called me up one day and said, we're going to have a new training. Would you like to join the class? And I just said yes. I just said yes. I just knew I had to keep doing this. I didn't even think. I just knew I had to do it. Something inside me knew. Somatic experiencing is a method or an approach to resolving trauma in the body, really working with the nervous system. So they say, and actually they work with all the systems, all the embodied systems, but also with language and metaphor, with thoughts, and and also with the spiritual quality. So what I would say to Rosen colleagues, or what I have said to Rosen colleagues about the benefits of Rosen has really taught me about presence, about being present with people, with whatever is. And that's really important for trauma work. To be astute and observing and listening to what people say and don't say, watching people in their bodies, especially the breath. And that's what we bring, a sense of resonance, being able to drop into the emotional and resonant field with a person. It's really critical for SE and for Rosen, and that's how I learned it, from Rosen Method. And the other thing I would say for SE colleagues is that Rosen Method deeply promotes embodied self-awareness and a sense of our ability to regulate ourselves when we get anxious and nervous, when we dissociate, when we're alive. It's a listening touch. It's a touch that says, I'm here, there's nothing you have to do. It's a non-doing contact. And because we understand the need for self-protection, we don't rush. We are very patient, waiting respectfully for our clients. We invite them to show themselves to us. We also follow a client. We know how to track a client through observing their autonomic nervous system, through their breathing, their muscles and tissues, and their heart rate. These are all indicators of activation and settling, which are very key for somatic experiencing. And when a client stops holding, when they are able to let go of their adaptive, self-protective patterns, either somatically or emotionally, and at that time, another possibility of how else they could be in their lives arises. And at that point, there's an opportunity for change and for internal and natural self-regulation. And that's where we find our aliveness.
Accepting.
My first Rosen Method body experience was 13 or 14 years ago. A good friend made the appointment for me, and she lived a couple of hours away. And I was in a fairly bleak state at that point, and I could hardly get a deep, full, satisfied breath. I felt very constricted around here. And I have to say that first session, and I went back the following day for another session, it was love at first touch. I felt like I started to wake up. I'd been sleepwalking. And it was just such a new experience for me. And I made a commitment early on in that time period to really start to be so honest with myself. And I started paying attention to my well-being in such a profound, different way than before. So it was life-changing for me. What drew me into Rosen Method and continues to keep me drawn in to Rosen Method bodywork is that, to me, Rosen Method is like opening up all the doors and the windows to my house. And it's this house where I have all of my life experiences, the mysteries, the blocked energies, the creativity, my voice, my attitudes. And I'm letting in the air and the sunshine. And I'm also spring cleaning. I didn't realize at a certain point, and this was very early on, that I was living with this attitude of stay in this life situation or die. And it sounds kind of extreme, but I had recovered from breast cancer several years before, so death was actually a viable reality, and as I later realized, staying in that situation was also like being buried alive. So to be in that session, to really feel myself and to have the awareness. I've had many ahas, many awakenings on the Rosen table in a Rosen session, and to actually be able to stay with that with a sensitive, skilled practitioner acknowledging me and my experience, not fixing anything. I don't want to be fixed. I just want to know where I am, and to be able to have that sense of spaciousness, then something else emerges. And in that particular pivotal experience and awareness, I realized I have other choices. And it percolated for a couple of years, and then I did make other choices, and I've come to what I consider a very healthy state. After having those years of private Rosen body sessions, I realized that I was mining for gold here. And it brings to mind the expression that Marion often quotes, the 15th century physician Paracelsus, who said, "In every human being there is a special heaven, whole and unbroken." And I realized that was what I was reaching for within myself, and the essence of myself allowing for greater physical and emotional freedom. So I wanted to train in Rosen because I love to share good news. And I wanted to bring Rosen Method personally to family and friends, and professionally to the medical community in my valley. Nursing colleagues, nursing friends, doctors, physical therapists, we agree on the physiological benefits of Rosen Method. Decreased cortisol levels, pain dissipating, anxiety dissipating. And for me, because I am part of a cancer wellness program, which is affiliated with the medical center. It's Synergy Wellness Center, which is part of Queen of the Valley Medical Center in Napa, in California. I'm part of the cancer wellness program there. And so the bottom line for me is what my patients who I've worked with tell me. And one patient said she was conscious of her own body and listened to it and allowed herself to feel what was going on inside. And this is new for her, she said. And particularly she's aware of this at night when she's read a book, turned out the light, she's resting in bed, and she hears body sounds that she's never heard before. And now she's listening to her body. And one other patient, young guy, has a brain tumor. He's been undergoing treatment for the last 9 months. And he says, Rosen Method brought a calmness of body and soul. More than anything else, it centered me. I had the feeling I was healing. His last 2 MRIs have shown that the tumor is diminishing and the site is healing. I had the feeling I was healing. That's good medicine. That's integrative medicine. It's very, very compelling. Unanimously, the patients who I've worked with, who are actively engaged in the healthcare system because of cancer and other chronic conditions, tell me that Rosen Method bodywork brings them deep relaxation and peace. Rosen Method facilitates this state of rest through gentle touch, supportive words, and the practitioner's presence, so that muscle tensions can be released, anxiety is lessened, pain is diminished, and the patient can reconnect with their body's innate healing capabilities and their wisdom.
Moving and living with ease.
I came to Rosen about 12 years ago, and I backtrack a little more. I had a lot of ballet as a child. So when I took my first movement classes, I thought, pretty simple, pretty basic, easy. But I had a lot of fun, and I so remember my teachers delighting in just moving their joints, moving the ankle, the foot around, the arm and the wrist, and that joy was contagious. The Rosen movements are, I call them now pedestrian. They're very simple, they're direct, they go right to each joint of the body, and they're common, like walking is common. But somehow they invite a sense of dancing and aliveness. So the joy I had as a ballet dancer as a child, I felt again after many years away. So it was a wonderful first experience of movement. And also, after these seemingly easy, simple classes, I would walk away to my car feeling so different. I felt smoother and lighter and also fuller, more fully myself. In general, Rosen movement classes are welcoming. They're inviting. They say, come as you are with whatever movement ability you have. You can be a prima ballerina or you can come in a wheelchair. And then there's a community in the class that's very supportive and welcoming. So that in and of itself drew me in. How could it not? But something else also really drew me. And that is, so I had ballet as a child that I was passionate about. But my young adult life I spent in academia. I was either studying in college or graduate school or teaching academic subjects. And in that world, intellectual pursuits are high and the body is low. So I came in with that kind of split and that idea that all this brain work I've been doing is of great value, but say ballet or physical things are of low value. And in this movement world, Rosen movement world, all of me, the whole of me was valued. Movement was seen as a way to discover yourself. So that really drew me in. So I decided to train in Rosen movement. It just felt like a natural fit to me. The ballet background I had, the love of movement and dance that I had kind of left behind, I was able to renew. And Rosen movement invites, again, the whole. So part of a movement class is your spirit, your mind, your awareness of your whole body, and what you bring out into the world from there. So it was a very natural fit. And something really surprising happened in the training for me too. I started the training and I thought, this is a breeze. I got these movements down. I can choreograph a class, no problem. And this was early on in the training. And I thought, why do I need the rest of the training? But each workshop or intensive that I took to complete the training, I learned to stop performing movement. And to stop, in ballet, I would look in the mirror and make sure that my leg was at the right height to look beautiful. But in my movement training, I learned to feel into myself and not look in the mirror, and learn to move, from this core, and not worry about how it looked. When an Alexander student that I'm working with seems unusually tense or just really unaware of where their bodies move, for example, our hip joints move. That's a good place to move from. When a student has that kind of problem, then I often recommend that they try a Rosen Method movement class, because the movement classes move the joints the way our bodies are designed to move. And it's a great, fun place to explore that kind of movement. And it's very relaxing. The classes are non-competitive, they're very supportive, and sometimes silly, sometimes moving, but they allow students to get out of their own stuckness, I think. I've also had Alexander students who had a lot of emotion when I've worked with them, and that's fine in an Alexander lesson, but sometimes I refer them as well to Rosen Bodywork sessions where they can really fully work with that. And then one more thing I would say is that for anyone who's studying the Alexander technique, teachers or students, the movement classes are a fun place to practice using our bodies according to their designs. The movement class and the Alexander technique teach some of the same things about how we can move with less work, more efficiency, more pleasure, more lightness. Rosen Method movement is a low-impact form of exercise that consists of gentle range of motion movements that are designed to work with how our bodies move easily and efficiently. And I would put Rosen movement classes in the field of somatics as much as in the exercise world. And that's for a couple of reasons. One is that Rosen movement is often done slowly and with great awareness. We're not just putting the body through its paces and trying to get our heart rate up. There's really a deep awareness in everything that we do. And another reason, I think, is that Rosen movements tug on our emotions and our attitudes that are deep in our posture and in our musculature. So, that's looking at ourselves as a whole that includes our emotions and our spirit and our body intertwined. And Rosen classes are fun. They're playful and lively and enlivening.
A changed attitude equals a changed body.
My first experience of Rosen was in a workshop And we were all, most of us were newcomers. And I was being worked on by one of the students when Marion Rosen came over to the table, and she put her hand right here on my chest. And her touch penetrated me in a most amazing way. I felt that I was taken into a different world, that I, at some level of myself, knew was there, but I didn't know that it could be touched. And I didn't know that touching someone could be like that. And I came to that workshop at the suggestion of a psychotherapist I was seeing, and I had been talking to her about how burned out I was with my work as a physical therapist. I've been doing physical therapy for about 15 years, and I felt that I just wasn't getting to my patients, or I was not able to help them beyond a certain point, and was thinking of going into psychotherapy. And she said to me, like a light bulb went off, "I know what you want, the Rosen Method." And I found out where they were, and there was a workshop right away, and that's how I got into it. I think what drew me in about the Rosen Method was the notion, or is the notion, that what we are, what we think, our attitudes, what we feel is all in the body. It's revealed in the body, but not only that, we can actually touch it and witness it in our own body and in other people's. It's actually accessible and it's real. So it was the notion of the wholeness of the person, which was something that I went into physical therapy with the idea of discovering what we're all about as human beings. And I thought I would start with the body, but it never really took me there. And there was this aspect that was always missing of the wholeness of the person. I decided to train in Rosen Method because I wanted to be able to work with my patients in a way when I could really understand them and see what was underneath the surface. Very often they would come in with pain, and I would have a sense when my hands were on them that there was a lot more that was going on with them than pain. And I had no way, no tools of being able to reach that part of them. And I also realized at that time when I was working with manual therapy, so my hands were on people all the time, that I didn't have enough space in myself, and that I needed to be able to unblock my own barriers and find my own resistances, or at least be aware of them, in order to be able to work with other people effectively. Well, I see benefits for the physical therapist who works with Rosen in that many times people come to us because of pain, because of dysfunction, not being able to move well. And they kind of give us, the physical therapist, this package of problems. And I know that I am not capable of sorting this out or fixing them. the problems can be enormous. And it really has to be a reciprocal relationship and a participation of both therapist and patient. So the Rosen Method is something that, a way of working with my hands on the body that enables the person to become aware of themselves, the wholeness of themselves, and not only their blockages and what may be hindering their recovery, but also their own power of healing. Each individual has a capacity to heal within them. I trust this enormously, and I know it after being a physical therapist for over 30 years. And Rosen Method is a way of enabling that person or assisting them to come into that insight for themselves. As far as benefits for the patient, well, I think I've probably said most of it. For me, the bottom line is insight into oneself, the ability to integrate areas or periods of one's life, excuse me, which one may have not wanted to look at the time or not been able to look at the time. So for the patient, being able to actually be able to look at those times and and integrate it into their lives, that in itself allows a freedom to heal and to move onwards in life. I would first like to say that this is a type of manual therapy where we have the hands on the body. But my intention as a Rosen Method practitioner is quite different. My intention is not to change anything, to fix anything, to take away the pain. But what my intention is I'm extremely curious, intently curious about that person, about who they really are in their essence, because that's where their healing and their capacity really lies. My touch is different, and my touch is different in that it's not manipulating. My hands are very soft and receptive, and through listening very deeply with my hands, with my whole being, my consciousness allows them to become aware of themselves. And in that awareness is the possibility of being able to accept who they are, where they are in life, in the moment, and ultimately to be able to move forwards with greater freedom. I do refer people to Rosen movement classes, and I'm fairly selective about how I do it. I'm selective about the kind of patients. I wouldn't select someone, for example, who is very involved with yoga or Pilates and gets an enormous amount out of those types of exercise. But sometimes there's an individual who I feel would really benefit from a kind of uplifting participation in movement with other people. There's a joyfulness and a lightness and a playfulness in the Rosen movement which allows people to find a different place in themselves, which I don't think you find so much in structured exercise. Not everyone is open to exploring that, but my antennae are always out for someone who I think would benefit from that, from the Rosen movement.
letting go.
I chose to do the training in Rosen Method because I realized that in order to learn those things that I wanted to learn, I would learn it best by really immersing myself in the work, first in the body work and then later with the movement training. Some of the benefits of Rosen Method relate to body awareness, and also I learned things about observing another person, observing a client or a patient in a much more refined way than I had learned in medical school, and also to listen in a different way, to not only listen to what the patient was saying, but to listen with my hands. I'd been taught to feel for abnormalities, to feel for masses, and to use my hands in my work, but again, it seemed to be a much more subtle and also rewarding way of making a connection with another human being. It was actually unanticipated. I went into the work and into the training to, I think, more for sort of self-knowledge and self-awareness, and ended up being able to connect with other people in a way that had not been open to me before. I'd like to say just a little bit more about the benefits of Rosen Method, because there's a benefit to the doctor-patient relationship. If a patient is more aware of what's going on in their body, they're able to engage in the process more fully. They can report what's going on with them. The history that they give is more, to my mind, more realistic about and more informative. And they're also, in my experience, more interested in taking care of themselves and really participating in their health care. I also think I think it would be wonderful if pre-professional students across the board were able to do a little bit of Rosen training in order to get those listening skills and those observation skills. The way I would sum up Rosen in a very short period of time for another health professional would probably be to say that it's a hands-on bodywork method that involves direct contact with the most tightly held parts of the body, and in the process brings awareness to that part of the body and also release, both physical release and relaxation, and also emotional release. I'd like to say also a little bit about Rosen movement, because I am a Rosen movement teacher, and I've taught Rosen movement in senior centers and hospitals, and I've had students in my class that were in their teens and students that were in their 70s, 80s, and 90s. And I also remember that in some of my very first movement classes to take as a student, the teachers were in their 70s, and they had a sort of mobility and grace that was characteristic of a much younger person. And even folks confined to a wheelchair can do the upper body parts of of Rosen movement. And not only does it add to flexibility and balance, but also the classes elevate the mood. They're fun and they really seem to help people come alive.
Alan Fogel, my dear friend and colleague, it's really lovely to be with you, being able to have this conversation about things that we're both very interested in, and that you have made an amazing and are making an amazing contribution to Rosen Method and to all of the somatic field.
Thank you. Yeah, I'm glad to be here.
Yeah. And remembering how we met, which is I'm a Rosen Method practitioner, bodywork practitioner, and a primary supervisor. And you came to me for supervisions in your internship as a secondary supervisor.
I did.
Yeah. And I remember the sense of calm and focused inquiry you brought to your work, and I was very moved by you.
And I remember sitting in your office drinking tea and feeling very soothed and just being in the right place.
Being in the right place, that's great. Yeah. Well, I don't think I realized it at the time. I don't think I realized how accomplished you are. And that you came to Rosen as a research psychologist from the University of Utah at this time.
Yeah.
You've had other placements. And after your internship, and you became certified, we were working with you in a study out of the University of Utah of the effects of Rosen Method on chronic back pain. Yeah. Is there anything else you want to say about that?
About the study?
Or just how that came,
Oh, well, I mean, I had been studying mother-infant communication and emotional development for, since the early 70s, really.
Wow.
Yeah. We made videotapes of mothers and babies communicating with each other, and I was looking at their body movements and their nonverbal communication with each other and their emotional expressions.
Both the mothers and the infants?
The mothers and the babies, and tracking how individual couples, mother-baby couples, changed over time across, actually, we tracked the same mothers and babies over a 2-year period. So that kind of research where you take a family or a therapist and a client, and you follow them frequently over time, a kind of case-based research is a kind of research I'm used to doing, I love doing, because you can really see how development unfolds and how people change in the process.
That really speaks to me. Both, remember being in the room where you did that research at the U of U, and we were on little pillows, and the cameras were low, and I felt a connection between the work that you were inviting us to do in the study on chronic back pain and that sense of the relationship of mother-child. So I guess it's a relational.
Yeah, it's about understanding what can happen to us when we engage in close relationships.
Right.
It changes us in important ways. And one of the things that appealed to me about Rosen Method, based on my, all those observations I'd made about mothers and babies, is that when a parent could be emotionally available for a baby, then that baby could feel what she felt and be who she could be. And then when I get introduced to Rosen Method, this was like, wow, here's a way of working with adults that's so similar.
I really appreciate that explanation. I get it. I see that. And it raises the question, though, how did you you became a licensed massage therapist and then found your way to Rosen. How did that segue from observing very sentient research psychologist to actual body work? How did that happen?
Yeah, that's a good question. I actually became a massage therapist after I started my Rosen training.
Oh!
As a way to be legal.
To be licensed, right, that's what we have, right. Okay, that's good.
But the question about how did I get from being a research psychologist to becoming a Rosen practitioner, I think I've always been embodied in a lot of different ways. I've always been an athlete. I've always, since I was a young child, I was playing baseball and basketball and bike riding, and I was always doing some kind of athletics. And then of course my interest in the babies and the mothers was all very nonverbal.
Oh, absolutely.
In terms of how they expressed and moved their bodies, and something I learned, I got attracted to when I was a graduate student is how nonverbal communication happens, even between adults. You know, how close we sit to each other,
and
how far away,
and
whether we're touching each other, and all of those kinds of things. So that was part of the story, but it's sort of what I call my conceptual self-awareness. It's what I kind of know. I can tell a story about that. But there's a more embodied part of it.
Please.
Which is when I was in my late 40s, I just started feeling terrible. I felt, I guess it was some kind of midlife crisis, but my body started being achy. I was getting constant headaches. I wasn't functioning well. I was a bit depressed probably. And I tried some psychotherapy, and I tried massage, and I tried yoga, and I tried a lot of different things, and nothing was really, there just felt like there was something that didn't get reached, and didn't get found inside of me. And I met someone living in Salt Lake City at the time who was doing Rosen Method Bodywork.
Wow.
And
just accidental meeting?
Actually, my wife met her, and she said, "Oh, you might want to meet this person. You might want to see what she has to say." So that was really the beginning of my love affair with Rosen Method. Because as soon as this person put her hands on me, I knew that there was something completely different about Rosen Method than anything I had ever experienced before.
Could you just take a moment and see if you can say anything more about
that?
that?
If she was reaching somewhere deep inside of me to a place that had never been touched or contacted. And that's probably what was hurting so much, is that even in childhood, that place had never been really met and contacted. And so I just, there's something about the feeling of being met. And the touch was really important to me. There's something about touch that was missing. I know it was missing in my childhood. And I saw, the mothers and babies touching each other, and a little bit of longing in me for some of that. And I don't know. So there's this conceptual story, but the real embodied part is just how deeply I felt touched and opened and vulnerable. And that led me to...
But vulnerable in a positive way. Open to yourself. And to others. Oh, that's wonderful.
Yeah, it was wonderful.
And it's not unlike how I came to Rosen, which is I was in Jungian analysis, and my analyst, who was a wonderful woman, said to me one day, I wish I could put little weights on your ankles. And I'll never forget that. I'm going, that was such a concrete picture. And she said that I wasn't up and not down. And she said, I think you should go see Marion Rosen. And she never told me to do anything, so I picked it up very clearly, and my path was to get on the table, and that's when I found Marion I notice I'm going like this, I can just feel it. Marion was working in Grand Avenue basement, and I saw Sandra Wooten, and I'd done a lot of therapy, and when Sandra put her hands on me, it's like I couldn't fly away in a really good way. And also what you said, that sense of, Sandra said to me at one point, what is going on now? What are you aware of now? And I went, holy moly, she knows what I'm thinking, you know. And so the mask could come down, and I just, the touch and the being reached. Yeah. So.
Yeah, that's the part about being embodied and feeling embodied.
Right.
Embodied, and awareness of yourself as a living in a human body completely. What that really feels like. And not trying to come out of ourselves and think about ourselves and get away from ourselves.
Right. Lovely.
So, yeah, I like that image of being held down so you couldn't fly away.
Yeah. So I love that you're talking about sort of embodied, and that brings me to one of the reasons I love your book, out of many reasons.
Mm-hmm.
And you know, when I was doing my training in Rosen Method, I don't remember the word embodied. You know, we talked about our bodies, and we talked about muscles and breath and muscle tension, but we didn't talk. I don't remember talking about embodied, that word, which I've come to be very curious and interested in. I'd love for you to say something about your understanding and experience of embodied.
Well, I know what you mean. I think the way we've languaged or talked about Rosen Method hasn't involved a lot of that kind of language. And I think it partly came out of Marion's training as a physical therapist, which is more, in some sense, structural, although what she found was that helping people feel whatever was there was the key to changing them, to making them feel better. So my experience, both as a client and as a Rosen Bodywork trainee, was that really that was really the core of it, was just feeling, just allowing oneself to be in the present moment with whatever was there. And that takes a long time.
So bringing our awareness
into ourselves.
Right, into. So it could be emotion.
Yes.
It could be sensation.
Yeah, it could be like feeling tingly or feeling soft or warm. But it could also be, you know, feeling angry or sad.
Right.
Or whatever comes up.
So it feels like your sense of it, of embodied, sort of expands and becomes more articulate about what embodied means.
Yeah, I started getting curious about that after I finished my training, actually.
Yeah,
I wanted to become embodied first, because I'd been in my head for so long as an academic and scientist.
Yeah.
And I didn't really I was a practitioner for 2 years before I really started to think about what I was doing instead of just experiencing what I was doing. So I really had to give myself that opportunity to feel.
Right. And can you say a little bit about the change or what you noticed in terms of your felt awareness during those 2 years? Just if anything comes to you.
Well, it was just more available to me. I was more able to be present with what I was feeling in the moment, and if I felt, anxious, which I tend to be sometimes, I might not have been able to feel my anxiety per se, but I could feel that my shoulders were tightening.
Right.
Or my eyes were getting sore, or there was some indicator that I could kind of tag onto, and that would help me. I must be feeling anxious. Yes, I am feeling anxious. So I was able to get to a place like that after my training.
And that's amazing. So the awareness, it is like Marion says, only you're breaking it down a little more clearly. We have the felt awareness. Then we can name it. Oh yes, my shoulders are tight. Oh yes, that means. Oh, okay. And we stay with ourselves in the moment.
Yeah. And the use of words is important, I think, in the work, because the words, Marion says the words make it real. Like you can touch into an experience,
Right.
but when the person who's having the experience can name it, and it feels right or true, or the practitioner can name it, then there's even more relaxation. There's more, oh yeah, I finally, yeah, somehow I get it, both in my mind and my body.
There's so many things going on in my mind about what the experiences have been with Rosen when talking about getting behind the muscle barriers, the chronic muscle barriers, finding through the breath, finding the aliveness inside of us, and also she would say what is true, that's what's true for us. So I'm just curious about the experience, not the conceptual awareness, but the embodied self-awareness, how that matches up or integrates with Rosen in your language, in your experience. If there's anything more you want to say.
Well, that's what we are doing in Rosen, from my perspective, is we're facilitating access to embodied self-awareness. We're helping people feel it, and then we're gradually helping people regulate their ability to stay in the moment with their feelings. Because when we first start to feel something, it might frighten us, or it might be too much for us, so we'll just come right back out of that.
Yes, I know that.
Again.
Yeah, absolutely.
So we go from the conceptual, we dip into the embodied experience, and we go right back to thinking something else. And embodied self-awareness is this ability to sustain that moment of experience without jumping right out of it. And it requires regulatory centers in our brain to literally grow new connections to help us regulate, sustain, be present with ourselves over a longer and longer period. And we need another person to do that at first. We can't do that by ourselves.
The witness, the compassionate, neutral but present, very present.
Yeah.
I'm reminded about the attunement with babies and mothers. If the practitioner isn't attuned, boy, I can tell you I'd be out of the room.
Right, exactly.
Yeah. So the containment and the contact and the presence.
Yeah, and there's something about the touch in Rosen Method that's unlike any other touch therapy or discipline that I've ever experienced. There's something about both the receptivity and the connection that's made with the touch, but there's something else too. You can't just feel connected and happy and soothed to grow. You have to be challenged a little bit out of your comfort zone, but not too far out of your comfort zone.
Right.
So there's something about the way we touch as Rosen practitioners that not only helps people feel like, oh, it's okay for me to be here, but pushes them just a little closer to something that they've been avoiding.
I love the way you're describing that, because also self-regulating and expanding a person's ability to feel. That's not the way I came up through Rosen talking about it. And yet, I really appreciate the way you're describing it and breaking down the steps. And it also says a lot to me about how what I could bring to my practice. Initially it was just the connecting and feelings come up and isn't that good? And sometimes that isn't. You want, it's that mark of allowing people to grow, but not too much.
Yeah.
How did you figure that out?
Well, I mean, partly it was experiential, just
that's what I mean.
being in my own process and then learning to be a practitioner. I know I got caught into this thing. I always wanted to help people, and I wanted to comfort people.
Yes.
And I remember this coming up during my internship.
Yes.
I was always wanting to be there for somebody.
Right.
And that part about pushing people just a little bit more, taking them out of their comfort zone and out of my own comfort zone, so I could be there with them as they moved. That was a big growth experience for me. It really changed me and allowed me to be more present with my own growth process as well as those for my client.
That's excellent, because that is something that comes up with a lot of, I find, with interns, supervising interns, is no, it's not about helping.
Yeah.
Because then you go out of yourself to make people feel better. Did you learn that a lot too from your own experience of Rosen work as a client? How
Yeah.
your practitioner was there for you and would push you?
It's true, I did, kind of thinking back on it, but I think I had to be in the practitioner role to really get what my practitioner was doing for me.
Yeah, that's lovely. Yeah. So, is there anything else you would like to say about how your experience has influenced your concept of Rosen as we end here?
Yeah. I mean, I was saying earlier that my experience led me to go back to the science.
Ah, great. Yes.
And to investigate, well, if I've had these amazing experiences in my body, there's got to be an explanation. That's the scientist.
That's the scientist, yeah.
There's got to be
great.
some physiology in the body, because Miriam was so concrete. She wanted to really observe the body, and she used what she knew about anatomy to try to help her explain what happened.
Right.
But I knew something about neuroanatomy, and I learned a lot more about neuroanatomy, and what I found out was that there are these regulatory centers in the brain that help us stay in the moment with our experience, with our direct embodied experience. And there's just a lot of research now about how those really work and how they develop over time. So I feel much more confirmed, I think, in a way that Marion did too, about the fact that there really was a process in the body, inside the body, in our very anatomy, in our tissues, that explain these very powerful effects that we see and feel.
Alan, I feel like the Rosen community is really, really fortunate to have you so present and active to bridge the scientific research sphere and our daily practice with our clients of touch. Thank you.
Thank you.
Yeah.
So I'm Gail Bork, and we're here to talk about Rosen Method, Bodywork and Movement. And we're going to focus in on how neuroscience is involved, or what's going on in the neuroscience issues about Rosen Method bodywork. I know Alan, coming to him as a shared interest in neuroscience and Rosen Method bodywork. I was a physical therapist, I'm still a physical therapist, and came to Rosen because I wanted to work more holistically. And a friend introduced me to Marion and said, you have to study with her. And then after that, I became interested in the emotional work and psychotherapy and neuropsychology. So we have that shared.
We do.
Yeah. So I'm going to just start with, like, what's going on in a Rosen session neurologically, or from the neuroscience perspective. And I want to break it down a little bit. Maybe look at it from what's going on as what's going on in the client, and what's going on in the practitioner. So maybe in those two different ways you could talk about that.
Well, every session is a little different, so that's important to say, I think, because really every session, even for the same person, is always going to be different from one session to the next. So, but I think there are some ways we can talk about different qualities of experience that might come up during a session. So sometimes when we touch somebody in a session, we find that they're not responsive to our touch. We contact them, we make ourselves available as practitioners, but the person doesn't seem to be connecting with us. And so typically when that happens, we might wonder what's going on, or where are they? And they could be in a number of different places neurologically, but in terms of their experience, they might be wondering about something, whether this is the right thing for them, or they might be thinking about something that happened that day. So in a sense, when we're thinking about something, we're in a part of the brain that's up on the top, more or less.
Our thinking cap.
When people talk about being in our heads, we're actually kind of in the top part of our heads. But when people start to respond to the touch, and there's a connection that we feel that happens between our hands and even our hearts and the client's heart, something else shifts. There's a different neurobiology that happens when people start to, what we call in Rosen, drop into their feelings. Or what I call entering embodied self-awareness. So we become more aware of ourselves as a feeling being rather than as a thinking being. And when that happens, we actually do drop into lower parts of our brain that allow us to, that actually connect more directly into the body. And it's actually not just the brain, it's the connection between the brain and the body that really starts to become activated. This whole network of hormones and neurotransmitters and body feelings and experiences and emotions that just start to become more activated in that embodied self-awareness network.
What's going on with the client who we might experience as being very tight? We focus as practitioners on that tight muscle and think about, oh, maybe they're holding some emotion, or that there's something repressed or held down. What's going on with the client in that physical structure?
I think of muscle tension more as a kind of protection. We tense up when we're afraid of something, or we tense up when we're not wanting to feel what we feel. So we might have a chronic pain, for example, that keeps nagging at us and keeps bothering us, and it won't go away. But in a sense, we want to make it go away. So we do that by kind of holding on to ourselves. So, for example, people with lower back pain have a lot of muscle tension in their hips and their lower back. And part of that is just kind of like if you get hit and the first thing you want to do is just hold on and squeeze your arm to make it feel better. We kind of do that for ourselves unconsciously.
Bracing.
Kind of bracing against the pain. Or against an imagined pain that somebody might have inflicted on us at an earlier time in our lives.
And emotional pain, do we also brace in the same kind of way as is for physical pain?
Well, I think that it's hard to separate emotional pain and physical pain, because we feel emotions in our bodies, We feel sadness maybe in our face and our hearts, and we feel anger, up here somewhere maybe, or in our legs for kicking. So there's always some component of sensory and motor experience that's connected with an emotion. And a physical pain is in a way, that's how we feel emotional pain, is through our bodies.
Let me ask you about, from the practitioner's perspective, and in Rosen, the dyad part of it. What's happening between us from a neuroscience perspective? What's resonance?
Well, it's interesting because similar parts of our brain as practitioner can get activated when our client's brain is being activated. So sometimes when a client starts to think and they go into this part of our brain, we might feel them pulling away, and then we might start to wonder what's going on. So we're thinking a little bit. And then as we let ourselves, we as practitioners, because of our training, we've developed the ability to feel ourselves coming out of our body, and then we allow ourselves to come back into our body, to feel more deeply that embodied self-awareness. So as those circuits in our body become more activated, it gives an opportunity for the client to follow us somehow into that place. And maybe they can't yet, but we can be there with them, and we can wait for the possibility for something to open up in them. But we need to have that regulatory ability inside of ourselves as practitioners to keep coming back to ourselves, even when we do get sidetracked.
Is there anything else about Rosen Method per se and neuroscience that you've observed or?
Well, I actually got curious about neuroscience because of my experience as a Rosen practitioner and as a Rosen client. It just fascinated me that so many things could happen inside of ourselves and such powerful effects could happen. And I was guided by Marion's belief that these were very concrete things that could happen in a body. They weren't mystical in a sense. Even though you might have experiences that felt spiritual, there was some kind of process that was happening in the body. Marion really believed in that. And so, as a scientist, I just got curious as I progressed in my training. I just got more curious, well, what is happening in the body? And it's not only in the muscles, and it's not only in the skeleton. It has to have something to do with the nervous system. And so I just started investigating that.
Great. I'd like to bring up another topic now that has to do with Rosen Method, my experience of Rosen Method and trauma. In the training with Rosen Method, we were often talked about trauma there was no difference between a particular kind of experience that was not traumatic, like not getting something or being angry about something relational, as opposed to a traumatic experience. And in my experience as a practitioner, I have felt that there really is a difference, because there's something very different about a person's experience that happens to them and the experience in their bodies when there's trauma, such as surgery, which can be very traumatic, or sexual abuse, or physical abuse, or war, of course, shock trauma. So
that's different from a child not getting what she wants and feeling
disappointed or hurt even.
Right.
But there's, so I'm curious from the neuroscience or from your perspective of what is trauma and what's happening with us when we've been traumatized?
Yeah, that's a good question. So, whenever we're feeling stressed or under any kind of threat, like we won't get something that we want, that's a kind of threatening situation for a child, to abuse or war or assault or anything like that. There is a similar process in the body that occurs, which is that our nervous system goes on alert, and our sympathetic nervous system becomes aroused. That's the arousal response that helps us deal with the threat or the stress. And in addition, certain hormones are secreted into our body, in particular cortisol, which actually is a kind of blood sugar that gives us the energy to deal with whatever the situation is. So in a normal situation, like a child doesn't get what she wants and then eventually she does, she can calm down. And so eventually the cortisol actually functions not only as a way to power our muscles, but it's also a neurotransmitter. So it goes back into our brain, and it finds receptor sites in particular parts of our brain that hopefully tell the body that it's okay now, it's safe now, that problem's over. But if a child is repeatedly threatened and there's no help, or abused and left alone, or hurt and there's no help, or someone is in combat and there's no support for their experiences or feelings, then that cortisol is going to keep going. It won't ever shut off. And we now know that cortisol, too much cortisol, is toxic to the brain. It actually impairs brain function. So that means that the more serious the trauma, the longer it lasts before somebody comes to help us, the more, literally, the more impaired our brain becomes. And that shows up in terms of problems in thinking, problems in remembering, terrors that come on that we can't explain, flashbacks. It's as if our brain is dysregulated. And other things happen too. We get strong emotions that we don't understand, and our memory is impaired. So trauma really is different, especially when it goes on for a long time.
We might not even know that
we might not even know. We may just feel the symptoms that something's not right. Or we may attack or be angry with somebody that we thought we loved for no reason at all. Or we have persistent pains that we don't know where they come from. So part of the problem, and the reason why I think trauma needs some extra kind of training for us as practitioners to work with trauma, is it's really about helping people regulate themselves so new neural circuits can grow in their brain and their connections to the body to help them feel, to help them come back to what their real feelings are instead of the feelings that are so present that were aroused in the trauma and never got resolved.
And it sounds like that Rosen Method and Rosen Movement, both the bodywork and movement, can help with that regulation process.
Yeah, because in a sense, to regulate, to learn to regulate, or to re-regulate, we have to slow down. We can't just experience all the feelings just the way we have been doing, because in a sense that every time we have a flashback, every time we have a nightmare, it almost re-traumatizes us. It goes back through the same pathways in the brain, and it doesn't get any better. So in a sense, we have to help people to slow down so that they don't get overstimulated like they have been. We have to keep them in the moment, and a Rosen movement is very good about moving slowly, and a bodywork practitioner can learn when people do get dysregulated in a way to help them with their hands and their voice to come back to what's right here in the moment, and all of those kinds of things are helpful.
So as we are at this place in Rosen, and our teacher, as Marion Rosen, has passed on, how do you see the future of Rosen Method, and how do you see neuroscience as being important for Rosen practitioners in this next phases of where Rosen Method goes?
Yeah. Well, I think it's, there's no doubting that it's a loss with Marion gone. It's, every time I think about it, it's surprising. Because she's been such a constant presence for so long. But she is gone. And so there's a sadness, but then there are new possibilities. There's, I think the neuroscience and all of the science that can be related to Rosen work can change the way we think about the work, it can change the way we talk about the work, and bring us maybe to a different place, but hopefully one that still has that embodied connection that Marion had taught all of us so clearly to be aware of.
How Marion and her work changed all of us. You know, really changed our physical selves, our ability to be present with each other, and of course things grow and go forward.
And I've been doing teaching of Rosen, advanced Rosen practitioners and interns about the neuroscience, and what I find is that it really doesn't take people out of their bodies. It actually empowers people to really believe that they actually are feeling something inside of themselves, that there's a chemistry behind it, there's a physiology behind it. It somehow makes the experience even more real to have the knowledge.
Alan, it's been great being here with you today and having this conversation, and I'm so excited, and that we'll continue having these kinds of conversations.
Yeah,
So
me too.
thank you
Thank
so
you, Gail.
much.